finally decided to open your clinic or hospital, yet you are not able to decide what is the location of it, right? This is the most prominent problem we discuss with all the doctors when they start opening their clinic or hospital. So today we will discuss what are the parameters while deciding the location of a clinic. Okay, so Dr. Pranav, this is the main issue while deciding your clinic and hospital, which becomes a very prominent factor in the whole success of the clinic and hospital, the location of it. So how do we actually finalize the location of our dream project?
See, it is very important to have a proper location, because sometimes the hospital, if it becomes successful, that itself becomes a local address.
Yes. Yes.
Opposite this hospital, near this hospital, near AIMS.
Yeah.
So it is very, very important, and it also determines how much effort and how much money you have to put in the project.
Yes.
And that will change the whole ball game.
Yes.
So you have to sequentially and very, very methodically select the location.
Okay.
And for this, we are going to use the mind map.
Okay.
And we'll demonstrate that how a location is chosen.
Okay, sure.
So while choosing a location, what all points you should keep in mind? First thing is that you have to work on your own. You cannot rely for anybody that he will search a location for me. You want to play cricket, you want to bat, you have to see the pitch.
Yeah.
You have to bowl, you have to see the pitch.
So
nobody can tell you that you cannot work on the pitch report.
Yes.
So this thing you should keep in mind. You should always do a personal search. Go out in the field and do some survey. And there is nothing wrong in surveying, because this is going to determine your whole career.
Correct.
You can of course take a personal help, but nothing like a personal effort done.
Yeah. So professional help is always okay, but it will give you a kind of idea. Professional help can give you idea, but not actual reality.
Yeah. And there will be so many revelations about your own practice and others' practice you will determine when you do a personal search.
Okay.
So first thing is location, demographics, competition, building, and community factors. Coming on to the location aspect of it, first thing is the locality or the locale. Which area is there, whether it is modern, whether it is upcoming area, whether it is new area, or it is in the center of the city. What is the commute time? Are you taking 1 hour to commute, or your patients are taking so much time to commute? How much that will affect your practice?
So both your commute time as well as the patients, your targeted patients.
Yes.
Yeah.
Then coming on to proximity to other hospitals, like whether your hospital nearby, somebody has a big hospital, or what is the nearest X-ray center, what is the nearest ultrasound center,
Correct.
What is the nearest pathology center.
And the proximity of other hospital has a dual role.
For example, competitor also.
They are competitor as well as the collaborator also. Because if you have a radiology unit, then it becomes a collaborated. And if you are a OPD, which might be in hospital also, then it becomes a little bit of competition.
Even if a big hospital is there nearby, it becomes a support also. While some patient you are not able to manage, you can refer there. And that way it can come out as a bailing out for you.
Bailing out, yeah.
So whether your hospital is visible, whether your clinic is visible, whether it is properly accessible, like if it is on the second floor and there is no lift, so you are pretty sure that nobody having knee problem will going to come to second floor.
Correct.
Then whether it is on the upcoming area or old area, that will decide.
And both has its own advantage.
Plus and minuses are there in every case.
Yeah.
Coming on to demographic of that area, like what is the average age of this area, whether this area is having old population, newcomers are more there, what is the average income. It is a posh locality and you open a CSC kind of a hospital, it will not work. Or if it is a low paying area and you open the high-ended hair care system or a skin treatment system, it might not work.
Yeah.
Then competition, whether the doctors are there who are having similar specialization, or young doctors are there or established doctors are there, you have to keep in mind. Because if there is no competition, then you can be sure that you are really going to progress fast. But if there is a competition, then you should understand that there is a waiting time.
Correct.
Then building, very important is see the exterior. If it is an old setup, it is alright, but if it is a new setup, then you have to have an exterior, well exterior. Yes. Parking has to be there, it is a prime requirement nowadays. And elevators should be there if there is more than one floor.
Yes, yes, and especially the exterior part. I want to say that if you are in a central business district and which is very crowded and already people know that this is a doctor hub,
Yeah.
and there are a lot of doctors and a whole ecosystem is there, then it might not be that prominent a factor while deciding that location, because
Right.
exterior is always is okay because
People know that place.
People know that place and people are coming for
Yeah.
treatment. But if you are going to a new location where nobody knows about any kind of doctor, then people judge you according to your exterior building as well.
And even their photographs they are keeping on the Google, so you should better keep it clean and safe
Yeah,
and looking good exteriorly.
right. Correct. Other important factor when you are actually taking renting structure is your water supply.
Very important, water supply and its drainage. For example, the gravitational drainage is not good, then every monsoon you will face water clogging problem.
Yes.
And this will indirectly affect your whole system. Floor which you are taking, the floor, which floor you are taking, whether fire NOC norms are there and followed properly, whether the electricity is 24 hours by 7 and you do require a BGG set or backup,
Correct.
and how much you require that.
Yeah.
So these are all the aspects you should always keep in mind before because these can be real troublemakers.
Real troublemakers. And whenever you are going for a renting a building, whether for clinic or hospital, please check all these parameters: water supply, drainage, fire NOC, electricity, and DG set, because everything is covered either in NABH or fire NOC, or you are finally getting the approval for your clinic. So please take care initial part, and this should be your deciding factor while renting.
Even it affects the day-to-day operations also. Other accreditations तो बात की बात है.
Yeah.
And coming on to the community factors, like whatever your community is, if that is ready to support you, nothing like that. And there is nothing to exploit. I mean, politicians are exploiting communities, so doctors should always take the advantage of it.
Yeah, so if you are from a particular community and you feel that you have certain leverage there, you can start open that clinic in that locality, because it will help you initial traction.
Yeah.
Okay, obviously that will depend on your service and the level
Skills.
of your expertise, but initial traction you can always get with the community factor, and if it is available, why not to get it? Okay, and another important factor which we have just little bit discussed a little bit more about the upcoming and the old area. A lot of doctors talk about and ask us about whether I should go to the upcoming area, because every city right now India is in an expansion mode. Every city is expanding horizontally and vertically. So residential area which is upcoming, few doctors prefer that also, and few doctors don't want to go there. So how should one decide in this thing?
See, when you are planning for long term and you are planning to buy that area, that is when you should decide that which area is you are finally going to settle down. But if you are going to take a rented place, you can take it in any place.
Any place, and especially
You
in
can go
the
in the heart of the
central
city also.
Heart of the city, yeah.
Once you are deciding to buy, then upcoming area which has more residential expansion, that should be preferred rather than industrial expansion.
I think if you are going for a upcoming residential area, you should go by your municipality plans.
Yeah.
What are their 5-year or next 10-year plan?
You can have a look that where the metro is coming, where the new roads are coming, where are the rapid bus transit system is there, or new bigger projects are coming of residential area.
Correct. Because disadvantage is that you might not get initial traction. That is for sure. Obviously, there is upcoming area, so the footfalls will not be at that much if you compare with the old established area. But if you are seeing in a long term, it could be a beneficial according to your own personal plan.
Yeah.
So advantage and disadvantage is always there. Of course, in the old area, you will not get maybe your resident is quite far from the main locality. There will be traffic problem and commutation problem, but their footfall is high. So you can get your money back in a very few years.
Yes.
So that is a advantage, disadvantage, and in a long term, if you are actually looking for making an impact in an area, then I think upcoming residential area is good.
You can also take professional help in this, but if with the amount of information that you now have, it is easier for a professional person to be dealt with. For example, they can do a survey, but you should be able to understand the survey, feasibility reports. Then some initial expenditure you will do in this professional help, but that is worth it.
Right.
If you get a good professional help.
Correct.
And especially if you are planning a hospital of 50 to 100 beds, it is very, very important that you take it from a good professional person.
And especially banks also need your
Ask a
feasibility report,
yeah.
so that includes the survey in it. So obviously that professional help will help you. So you can do two type of search. Your personal search is like, one is your primary search, and then there is secondary. Secondary is what you do by internet. Okay, you go on the Google Maps and see what are the area, how different areas are located, and what are the different clinics and all this thing. You ask some people what are the different kind of setups in your locality and your seniors and all this. So whatever sources, secondary sources, are secondary research, and then you go and see actual on the ground. It is your primary search, right? So in this form, like your primary, secondary, and professional help, it will actually give you a holistic view whether you should go in your decided area or not. So thank you so much.
Hopefully they have learned a lot in the location aspect today.
Yeah, thank you so much.